Hi there. Thank you for joining, Andrew. Thank you, everyone, for joining us today. My name is Ashley Craven, and I am the Marketing Director of Griffin House. Griffin House is an award-winning book publisher for books and early childhood education resources for parents and for teachers. Today, we want to thank you so much for joining us. I think today's topic is clearly a little challenging and a little albeit scary, but Andrew is one of our Griffin House authors, an early childhood expert, a preparedness expert, and he has put together some awesome content to help all of us prepare for coronavirus or COVID-19, and also to help all of us, whether you're parents or teachers or program directors, help us to mitigate the effects of COVID-19. Some of you may be joining us having expected to see the webinar about Andrew's latest book launch, which launched earlier this month, Preschool Preparedness for an Active Shooter. Due to some obvious changes in the world right now, we wanted to take advantage of Andrew's expertise and allow you to speak with him directly about what's going on in the world today. Please do try and join our free online community for this Ed webinar and all of our other content. You can view today's recording, you can share it, you can take the CE quiz to get CE credits, you can download the slides, you can join other discussions and get invitations for future webinars. So lots and lots of free content. You can join our community by going to edweb.net/bookchat. New for spring 2020 includes Andrew Rozak's book. You can see that the top left-hand corner, Preschool Preparedness for an Active Shooter. It's part of our Preschool Preparedness series. This is the first of 3 books. His next book is launching this fall of 2020. Obviously, we were going to be talking about preschool preparedness today for an active shooter, but again, we did switch gears for today to talk about preschool preparedness for COVID-19. We are offering you, our audience, a special offer for joining us today. We are giving you 20% off if you use the code BOOKCHATS. Just go to griffinhouse.com and you will get 20% off of your entire order, including Andrew's latest book. Andrew Rozak has tons and tons of credentials ranging across the board in public health and early childhood. He is the executive director for the Institute for Childhood Preparedness. He's worked on emergency preparedness issues really across the board at all levels, local, state, regional, federal, so on and so forth for the past 20 years. He has expertise in emergency preparedness. He's been tapped most recently, I believe, in Puerto Rico. He supports with public health, law and policy, early childhood education, and so much more. He has worked each day with the CDC and 3,100 local health departments across the U.S. to help prepare communities for pandemics and disasters. So we truly thank you, Andrew, for being with us today to share your insight and your expertise as we are all trying to navigate the world today. So without further ado, Andrew, thank you so much for joining us. I will hand the mic over to you.
Wonderful. Thank you guys so much. We're going to talk today a little bit about coronavirus and COVID-19, which is the same thing, and really what it is, where it came from, how we can protect ourselves, and what it really means for early childhood. So I've got a few different slides that we'll walk through and talk through today. Really nice introduction. I really appreciate Ashley spending time and letting you know about my background. I am committed to helping childcare providers each and every day. That's been my full-time job for almost 6 years now, trying to figure out how to best prepare childcare programs to get them ready for disasters, to get them to respond to disasters, and the hard work of helping them recover from disasters. I started off originally as a firefighter paramedic in the Chicagoland area and have been working in preparedness ever since. I guess of applicability to this webinar, I spent 3 years of my life working at the National Association of County and City Health Officials. That is the organization that works with the county and city health departments throughout the United States, along with the Centers for Disease Control. And in that role, I was the senior director of pandemic preparedness. So this coronavirus is near and dear to my heart, something I've been certainly studying and preparing for many different years. Also serves as the Senior Public Health Advisor for the U.S. Department of Health and Human Services Emergency Care Coordination Center, where again, we were preparing for these kind of incidences and having a lot of the discussions that you're seeing happening right now about protective equipment and ventilators and standards of care and crisis standards of care and all that kind of good stuff. I also am an adjunct professor at Old Dominion University, where I help train the next generation of public health and environmental health and the workforce there. So if any of the students are watching, welcome, and we'll get some extra credit for hanging out with us today. So without further ado, let's get into a little bit here. As Ashley mentioned, this is part of the Preparing for the Unexpected series. The first book is out now. That's Preparing for an Active Shooter. The next one will be out this fall, and that is actually Preparing for a Natural Disaster. And then the third book will be out later next year, recovering from after a natural disaster and all the recovery work that we've sadly been seeing across the United States. So, you know, I know that times are tough, and I'll be real honest with you, times are tough for us too. Our bread and butter is working in early childhood programs every day, and it's been really weird these last couple of weeks not actually being out in any child care programs or Head Start centers. You know, most of the time you can find me on the road, and we've got a wonderful team of great experts that work every day, and we come to your programs. We help train you on emergency preparedness, on active shooter, on fire extinguishers. We look at site safety and make sure that your programs are as safe as they possibly can be. But, you know, right now in-person trainings aren't really happening. So we're feeling the pinch too, just like many of you who are, you know, out of work right now. So when this gets back up and running, I'd love to come out to your program and do some training with you and your staff. In the interim, we've actually launched an online course, an online module that you can go to. And for $139, you get access to all of our online content. And we've got 7 courses that are in preparation right now, including our coronavirus course, our active shooter course, and we have many, many more that'll be in development. So for $139, you'll have access to everything. I promise you we're going to have well over 7 hours of content on there. And also, I think by the end of this week, we'll be launching our Spanish courses as well. So we have them now in English. And I think by the end of this week, hopefully we'll have a course or 2 in Spanish. So really appreciate it in these trying times. If you think we're valuable, if you like what we do, I'd love your support. And hopefully with your training budgets, you can find $139. That would really go a long way to help us out. We have a lot of resources, and we're constantly updating our resources over at our website. That's childhoodpreparedness.org/corona. And you can find a whole host of stuff there. We're basically updating that almost every single day as you know, more stuff keeps coming out. I see the numbers just ticked up now. We've got 49,760 cases in the United States, and looks like we almost just crossed over 600 deaths, it looks like. So this is a rapidly evolving situation, and boy, information's changing very, very rapidly. We'll talk about some of this stuff as well here. So first and foremost, what is coronavirus? People have been asking, what is coronavirus? What is COVID-19? What is all that stuff? Well, COVID-19 is coronavirus. So it's a novel virus. It's one that had not yet previously been identified. It seems like it came from an animal, probably a bat, it seems. And COVID-19, we heard that term thrown around a lot. What does that mean? It means CO stands for corona, VI stands for virus, and D stands for disease. And then 19 stands for the year in which it was discovered, so 2019. It is being transmitted from person to person, as everybody knows. We'll talk a little bit about the transmission routes that are currently happening. But the symptoms are fever, cough, and shortness of breath, which are not much different than the typical normal flu, which I know some of us are dealing with. And also, as things start to get warmer, we're going to start seeing allergy season. So I'm sure we'll have a lot of people having allergies, seasonal allergies, and sneezing and feeling congested and all that kind of stuff. And, you know, maybe perhaps they're going to think that's coronavirus as well. So it's probably going to be a little bit tricky here to figure out who's got coronavirus and who doesn't for the foreseeable future. 80% of patients have mild symptoms. That's the good news. For the other 20%, we'll talk about that. But the good news is 80% of us, if we get it, we're just going to have mild symptoms. It's going to be kind of like an influenza, but worse. It is probably going to knock you on your bed for a few days. You have to stay on bed rest. But that's kind of where it's at. Now, symptoms appear 2 to 14 days after exposure, maybe. And I'll talk a little bit more about that right now, but we're seeing kind of a trend where we have a lot of folks that are actually asymptomatic. They don't have symptoms, which again is making this virus a little bit harder to track down. One of the things that came out over the weekend, and there's some discussion about this yesterday, but some of the folks that actually have coronavirus have experienced a loss of smell and maybe even a loss of taste. So that's kind of new and emerging. Again, we don't know a heck of a lot about this virus at the current time, but that seems to be something that a good portion of people that have coronavirus are reporting. So loss of smell and or loss of taste is a new sign that seems to be emerging right now. So a couple of things I guess we should just talk about, and those of you that know me know I'm a pretty honest guy. If you don't know me, you'll find out that I'm pretty honest, but I have no hidden agenda here. My agenda is making sure that our early childhood workforce is safe, healthy, and as prepared as possible. So let's talk about this stuff in reality. The first thing is this is not going to go away anytime soon, period. If we look at what happened in China, and I will say that I'm a little skeptical of some of the data coming out of China just because the way they approached this to begin with. But if we were to take China and look at the data that's being presented now, this pandemic over in China, they're just finally getting out of it. So it lasted 3 or almost 4 months. So while I think the president's doing a good job of trying to get the word out, and I understand the constraints he's under, he certainly doesn't want to cause panic and all that kind of stuff. His 15 days of stopping the spread, I think, is a noble cause, and certainly one that we'll talk about here in a minute why that's important. But the bottom line is after 15 days, this is still going to be around. So I don't want to set any false expectations. You're going to be hearing about this for several more months. There is a slight chance that in June or July, the virus may pull back. And this is, typically what we see with the influenza, the normal seasonal flu, that in the summer it kind of goes away and then it comes back in the fall. But to be honest, we don't know that much about it. And there's been some studies in laboratories that have been, 80 degrees or so, where this virus has still been pretty virulent and was able to be transmitted. And if we think about, I know Tom Hanks is down in Australia now, and he's got the virus, and some of the other folks do down there. And of course, Australia right now is going through their summer period. So if it's being transmitted down there in the summer, there's probably an argument that it may be transmitted here in the United States in the summer as well. The other thing that may happen is this may disappear over the summer and then come back again in the fall. And it's too early to tell, but it may end up, mixing with the regular seasonal flu, and it may be around for a while. The coronavirus, it may be around for the next 3, 4, 5 years. We don't know. We've seen similar things happen with other strains like H1N1 and H7N9 a few years back, where the same thing, it just kind of mixed and then it just kind of came back with the regular seasonal flu. So I don't think you're going to hear this going away anytime soon. I think we need to, prepare ourselves for the long haul here. And, talking to some of the experts, it is likely that 40 to 70% of the population may get infected with this virus. That's certainly not out of the realm of possibility. So let's talk about the stop the spread, the campaigns that we're doing right now, what we're going to call social distancing. Now that's a public health term. The last couple of weeks, we've been hearing a lot about social distancing. I've got to say it's a very common term among public health professionals. It's probably not as widely known in the general population. And I think given all that's going on, it may not be the best term to be using. So when we say social distancing, what we really mean is physical distancing. We mean staying away from other people. We don't mean doing stuff like this and having interaction and being social. I think we need that probably now more than ever, as many folks are feeling isolated, and I'm sure the kids that you serve, they're missing you and they're feeling isolated too. Luckily, we have this great technology that they did not have back in 1918 when the last bad pandemic hit. In fact, last night we were able to host a little wine happy hour with some of our friends. So that was pretty interesting. So I would encourage you to embrace technology. Look at things like Skype and FaceTime and Google Hangouts and all those kind of free services that are out there to stay in touch with one another and to keep in contact. So this graph really represents what we're trying to do. We have a limited amount of emergency room and hospital beds in this country, as everybody knows. If you've been to the ER lately, it's pretty darn crowded on a normal day. So the red line on this chart basically represents our hospital capacity, our steady state. This is how many beds we have. This is what the capacity is. And on an everyday basis, you're going to have people that have diabetes, people that have heart attacks, people that have strokes, people that have car accidents, and those are all taking up, space in the hospital. So what we are trying to do is we are trying to basically implement these distancing measures so that everybody doesn't get sick all at once. And you can see the different results that we have here based on the different curves. So that black line there, if you do nothing, you can see we have a dramatic increase in people that are sick and people that are going to need hospital care. And this is what we're seeing now in Italy. What happens is so many people need hospital care that the system is completely overrun, and hospitals end up not being able to care for everybody, and folks end up dying. And that's going to really be bad for the death rate on this stuff. So what we're trying to do is we're trying to flatten out that curve so not as many people get sick all at the same time, or not as many people get sick at all, by not spreading the virus around. So that's why you've heard so much on social distancing. I think this next graphic really illustrates the point pretty good. So right now, the kind of common thinking is that for every one person that has coronavirus, if they go out and go to work and go to the gym and go to the grocery store and go to the movie theater and go to the beach and do all these other things, on average, you're going to infect about 2.5 people. Now, I know you're saying, well, Andy, how do I infect half a person? Well, you got me on that one. These are averages, okay? So 2.5 is the average. I know you can't infect half a person, but you get the point here. So you can see what happens if we go out and we keep about our daily lives and we continue to interact with people and infect people. You can see how many people that one person now has touched. In 30 days, it's over 400 people. Whereas if you take, your time, you stay indoors, you don't go out, you aren't social, then we're going to have less and less people exposed. At the bottom case, one person there over 30 days only infects 2.5 people. So that's really why public health right now is really trying to hit home on these messages. We don't want a lot of people infected. And the more we do to stay away from other people, the better this becomes to manage from a public health and a healthcare point of view. So does this stuff work? Well, we've got some examples out there to look at. This is a graph of Italy. And you can see two different approaches that happened here. Now, if you look at the green line there, that's the town of Lodi in Italy. Lodi started on lockdown on February 23rd, which is pretty much right when this chart begins. And you can see how their curve is not quite as steep. It still goes up because people are still infected, and the incubation period, again, anywhere from 2 to 14 days, maybe even 17, maybe even 20 days is what we're hearing now. So you could have this thing and not have any symptoms at all, and could still be possibly spreading it to other people. But anyway, you can see two different approaches here. So Lodi went on lockdown right away. They ended up flattening that curve out quite a bit compared to Bergamo, as you can see, didn't go on lockdown until March 15th. And you can see just the rapid spread of people that got sick and people that needed, hospitalization and all that kind of stuff. And by the time they implemented their lockdown, which was not even on this chart, you can see it was already too late. So that's the big push now of why we want to get folks on lockdown, why we want to keep folks away. And this was this one here really scared a lot of people. This was out of the UK, out of the Imperial College of London. And basically, in their studies, what they found, and again, this got people paying attention, without any lockdown or social distancing, 81% of the United Kingdom and the US populations would be infected, with 510,000 dying in the UK and 2.2 million people dying in the United States. Yeah, that got your attention, didn't it? And it got the attention of a lot of politicians. And when this came out, this is what really started seeing folks take a more aggressive approach on, implementing these lockdown and shelter-in-place locations. I think right now we've got 18 states. It keeps changing. It's very, very hard to keep a handle on all 50 states. They're all kind of in different places. But I think the last I saw this morning was 18 states are on lockdown. I definitely suspect that number is going to increase. I think some places in Texas, I was reading last night, are starting to go county by county on lockdown. I know Florida has been a little resistant to doing it, but it looks like they're starting to get more aggressive. Certainly you've seen California, New York, and Illinois, Connecticut in the last few days. So I think that's going to continue as the virus spreads. And especially if things start going bad in New York and hospitals do start getting overrun, you're going to see other states get much more aggressive. Unfortunately, if you look at the data from Italy, that may be too late. So this is just another chart, and I'm sorry to give you so many charts, but you know, in public health, we do a lot of charts, and you know, we get to kind of be nerdy. So I wanted to share some of this data with you. It's a little bit better than just watching me talk, right? So the other thing that we're really looking at is the hospitalization versus the people that need ICU care. And as you can see, a lot of people, I think it's about, I think I've got it on the next slide, I think it's about 20% or so of the cases actually that get into the hospital need ICU care. And that's why you're hearing so much of this stress about the ventilators and the personal protective equipment and all that. And what we're not hearing yet about ventilators is, yes, the ventilators are always going to be in short supply. We just don't have that many in the United States or in the world for that matter. But the other big piece, and we haven't heard about it yet, but I'll suspect we'll hear about it here in a few days, are what they call circuits. And that's actually the tubing that goes into the ventilators and then connects, you know, to the individual patient. The circuits are very, very important. They're also going to be in short supply. They have to be changed regularly, and of course you can't, you know, use one circuit on another patient. So, and they're not interchangeable between different brands of ventilators. So you're going to hear more about these circuits, I think, in the next few days. One other note on the coronavirus: this is what they call an RNA strand of virus. It's in the same family that the seasonal flu is. Ebola is also an RNA, and these things love to mutate. They mutate like crazy. And this case here with coronavirus, this is like a mutation's dream because there's so many people across the world that are infected. So there's actually, if you look right now, there's about 5 or 6 different mutations that are going on in the world. You've got kind of the blue and dark blue over on the right side of the map, and then you've got some yellow and some blue and some green over towards the middle of the map, and then you've got some red over there on the west coast of the United States. These are all small little mutations, and this is just something that RNA viruses do. This is why every year you have to get a flu shot, because the virus mutates each year. So the flu shot you get last year is not going to be as effective on the strains that are going around this year. What does this mean? We don't really know yet. I know a lot of smart people are looking at this. They're studying these mutations to see what effect that they have. You know, this could be one of the reasons that you're seeing a more higher death rate in Italy than you are in other places because of a mutation. This could also have implications for how we're going to treat this virus in the future if we look at the vaccines and stuff. So again, this is part of an RNA virus. We totally expect this kind of behavior. We saw this in Ebola. We saw this in influenza. We've seen this in a lot of different other strains. But I did just want to point that out, that some of these mutations are occurring. You'll probably hear more about this as the response goes on as well. Okay, let's talk about transmission and impact of the virus. Now, there's some really interesting stuff that just come out of Iceland in the last 48 hours. So Iceland is a beautiful country. If you haven't been there, I would recommend it. It's very close, about 2 or 3 hours from Washington, D.C. And what they do, they have a very small population. They're on an island, so they can get to a lot of the population. They tested almost everybody that lived in Iceland. And what they found is that, you know, it's crazy. What they found is about half of those that tested positive for coronavirus had no symptoms whatsoever. Half of the people in Iceland that tested positive had no symptoms whatsoever. The study over the weekend and from China came out on Sunday, and what they found is as many as 1/3 of the people who tested positive in China had no symptoms or delayed symptoms. So you've got half the country of Iceland with no symptoms. You got 1/3 of people in China, and then there was a big cruise ship, the Diamond Princess, where they tested a whole bunch of people. I think they tested everybody on board. And they found 46.5% of the infections were asymptomatic, so no symptoms when they were tested. Some of the studies out of China said as many as 80% of the confirmed cases got it from someone who didn't know that they had it. So when we talk about this being a silent enemy or a hidden enemy or whatever term you want to use, that's absolutely true. There's many of us that are walking around with coronavirus that are not showing any signs or any symptoms. And, you know, we don't know that we're sick, but we can go out and give it to people and maybe fatally, especially if you've got underlying risks, conditions, or you're elderly or have some of the other high risk categories. This is scary stuff. This is scary stuff because we don't yet know who's got it, and we don't yet know who doesn't have it. And what you're probably going to see is if hospitals begin to get overwhelmed in any kind of a sense that they are predicting, is we're going to have to stop testing in a major way because those frontline healthcare workers are going to be needed not to do tests, but to actually take care of patients. So there may come a time soon where we stop testing and just focus on patient care. Or the other way that this could go, I was listening to the president's remarks last night, and he just did a live town hall on Fox News in the last hour or so. There's a desire to try to open the country back up for business. You may see testing become much more important if we try to resume normal lives, because if we try to resume our normal lives, then it's really going to be important to know who has it and who doesn't, so we don't have people mixing this and continuing to spread this among the population. But very, very interesting the way this is spreading and the way that it can be detected or it can't be detected, and we have people walking around without any signs or symptoms that are potentially spreading the virus. So look, my advice to you at this point, we have to treat everybody as though they have the coronavirus. That's what we have to do, because we don't know. We also are learning a lot more about where the virus lives and how long it can live. Now, normal seasonal influenza, most of that is pretty much gone in 24, 48 hours. I remember during H1N1, we had a big push to shut down schools and decontaminate schools, and we were throwing chemicals all over the place. And, what we found out later is that virus dies within 48 hours. So basically every single weekend when class wasn't in session, the entire place was getting decontaminated. This stuff here, the coronavirus, it's a little bit more tricky. So right now, the current thinking is that it can live airborne in the air for up to about 3 hours. So airborne in the air, up to 3 hours. Now, how does it get in the air? It gets in the air by me coughing or by me sneezing or by me spitting or some kind of exchange out of my body to get it out and get it airborne. It can remain viable on copper for up to 4 hours. It can remain viable on cardboard for up to 24 hours. It can remain viable on plastic for up to 72 hours and on stainless steel for up to 48 hours. So while I think it's a great idea that many of the supermarkets are having these elderly shopping hours in the morning or whatever they're calling these things, the bottom line is if I'm elderly and I have the disease and I'm out there coughing and spitting and hacking and sneezing and all this kind of stuff, and then I leave the grocery store, I contaminated many stores, the whole products. So I think it's a good idea from a social distancing standpoint. We keep the elderly and make sure that they can go out, not amongst everybody, but limited availability. But when you really start to look at where this virus can live, I mean, all you have to do is sneeze on a box of cereal and then have somebody pick it up, maybe an hour later, and it's still live on there. Now you're taking that home with you. There's also been some new studies that just came out yesterday, and I got to give a shout out. Public health is a really small community. And one of my good friends, Leah, I actually used to work together with her. She was the lead author on this study, and I'm just so proud of her. And hats off to all the public health professionals that are working hard. But she was studying the cruise ship, the Diamond Princess cruise ship, and what they found in Diamond Princess is that coronavirus actually survived for up to 17 days aboard the cruise ship. That's a lot longer than we thought, guys. It's a lot longer than 24 hours. So we don't exactly know everything that we wish we knew about this virus. We have to be careful when we're touching different surfaces. That's why we have to keep washing our hands and taking precautions. But more and more stuff is being learned about it. Let's see, the other thing, 3,711 people on the Diamond cruise ship, 712 of those, so about 20%, had positive test results. Of these, about 45, 46% were asymptomatic. So again, there's that 50% that didn't show any signs or symptoms. And among the folks that actually had symptoms, 10% required intensive care and about 2.5% died. So those are the stats, again, and this just came out in the last 24 hours. So what does all this stuff mean? The virus lingers in the air. So isolate yourself away from sneezers and coughers. Even if you're outside getting exercise, if you're outside, walking around, if you're in the supermarket, you got to be careful. You got to stay away from people coughing and sneezing. Your packages, your mail, your groceries could potentially be a source of infection. So, again, I would advise you, if you get home from the grocery store, put your groceries away and make sure you're washing your hands. If you get letters, open the letter, read it. If you don't need it, discard it. Wash your hands. We've got to treat these surfaces like they're covered in viruses, invisible enemy. Also, clothes. There's been a lot of questions about clothes, and we don't know a heck of a lot about the virus and how it interacts on these softer surfaces. But I would say, if you're going out in the public, or if for those childcare programs that are still open, and we'll talk about you in a few minutes, when you come home at night, take your clothes, gently put them in the washer, and then, get them washed. If you start shaking your clothes, if you're doing some of this, you could potentially be spreading that virus around. So put them in the washer as soon as you get home. Wash them on the hottest possible setting that the clothes will tolerate. And again, make sure you're using, your detergent, and that will kill the virus. The good thing is the virus is pretty susceptible to any kind of soap. The soap really does break down the virus and kill it. That's why you keep hearing people say, wash your hands, wash your hands, wash your hands. And I'm not sure if my good friend Betsy Kagi is watching. I think she was earlier. She would be telling you, wash your hands. Betsy's a great friend and a really good public health advocate as well. The other thing I wanted to point out, we see this a lot in different child care programs. I know many of you have the wipes, the Lysol wipes, the Clorox wipes. I'm looking, I usually have a whole big can sitting here, and it's just off screen, you can't see it. These are really good. These will kill the virus. But you got to pay attention to what it says on the label. So I've blown up this label here so that you can see it. And if you see it says, wipe hard, non-porous surfaces with a wipe until the surface is visibly wet. Allow surface to remain wet for 10 minutes. Let air dry. So in order to actually kill the viruses, we're going to have to let that surface stay wet for 10 minutes. Now that may require you using a couple of wipes to keep it wet for that long. But if you have these Lysol wipes, if you have the Clorox wipes, if you have these HDX wipes, take a look at the back of the label. Each one's a little bit different. This particular one's 10 minutes. And it was funny, this was, we were actually down in the Virgin Islands at a childcare program, and they were using these to wipe off their changing tables. And they said, man, this changing table, it just stays wet so darn long. I always find myself taking a paper towel and wiping it off so it dries so I can put the next kid on there and change them. We said, whoa, if you don't let this stay dry for 10 minutes, you're not killing all the viruses and all the bad stuff. So again, these things are very effective. I would encourage you to continue to use them, but make sure you're reading the label so you know how to actually use them. All right, let's talk a little bit about kids. So one study found that kids are just as likely as adults to get infected. Now, we're not doing a heck of a lot of testing in kids right now, so our data is pretty limited. But what we found in a recent study of about 45,000 people, children under 10 years old made up 1% of those with the coronavirus, and none of the over 1,000 people that died. So that's good news. Now, again, I don't take too much stock in the fact that they only made up 1% of the people with confirmed COVID, because again, this is a pretty invasive procedure. I mean, right now the tests go up your nose and they go up there pretty far. It's not pleasant. So we're not testing a heck of a lot of kids, so we don't have a lot of good data on that. But the fact that kids are not, dying is a pretty good sign. Normally, when we think about influenza and we think about flus and viruses, we worry about what they call the bookends, and that is the very young and the very old. In this particular case, it's the very old that seem to be getting more affected than the young. But I think it's important to note that these kids can be and have been carriers of the coronavirus. So just because they're not dying doesn't mean that they're not actually infected with this, particular virus. And my big concern is now that we've shut down pretty much all K through 12 schools, most early Head Starts, most Head Starts, really the only game in town right now is childcare. But I'm worried that young kids are going to go home, and in some cases they're going to be carrying this virus, and now they're going to be watched by their grandparents. And I'm worried that they're going to transmit the virus to their grandparents, who are much more susceptible. So just a little note on kids. It's good to see that not a lot of kids are dying. That's really good news. But don't think just because they're not dying, they're not carrying the virus. And here's case in point right here in South Carolina, 7-month-old baby, and this is just, 2 days ago, 7-month-old baby tests positive for COVID-19. And this woke up from a nap running a fever, so we're going to go out, we're going to play out and see, but my mom tested positive for the virus as well. And the mom here in this case may have transmitted it to the young child. 104-degree fever is what the symptoms were for that 7-month-old. Over in Atlanta, we've got a 12-year-old girl being treated for the coronavirus. So that's down in Atlanta with the 12-year-old. And I think over in Maryland, we've got a 5-year-old girl in Howard County, and we also have a 10-month-old baby in Maryland. So, and the other part I put here on the slide is that there's 76 cases of coronavirus in Maryland, ages 18 to 64, and only 30 cases in those 65 and older. So, most childcare, the average age of a childcare worker is 36.3 years. So if we start to think about, we're not invincible in all of this stuff, and we are definitely getting the spread to the folks that are under 65. So we do have to take some steps here to protect ourselves. This is the total number of cases in California. Now, this is a couple of days ago, but look at here. In ages 0 to 17, 19 cases. Ages 18 to 64, 876 cases. Ages 65 plus, 321 cases. So yes, just because you are middle-aged or younger, you can still get the coronavirus. That's why people were getting so upset when we saw the kids out on spring break and on the beach and in the pubs and on St. Patty's Day and all that kind of stuff. Because yes, they are getting the virus for certain. The number of coronavirus cases in the U.S. surpassed 22,000 on Saturday. And look, now we're up to almost 47,000. Almost half are in New York State. And looking at the ones just in New York State, a majority of the cases, 54% of the cases in New York, were between the ages of 18 and 49. So again, I think early on the messaging was like, don't worry, unless you're old or unless you have some kind of underlying chronic health condition, this isn't going to impact you. But as we learn more and more about the virus and we start to see it spread from China to Italy to the United States, we're starting to see that that's not necessarily the case. So we do have to be careful and protect ourselves. All right, let's talk about the big question. We did a little poll here early on before the system crashed. And Rachel, I'm sorry, maybe I caused the system crashing by putting the poll up. But I was curious to know if you're open or if you're closed. So it looked like for the vast majority of you, you were closed. I think that's a good thing. If someone were to ask me if you should stay open or stay closed, I would say, please, for the time being, I think it's important that you close. Now, I do not take that decision lightly. I've written a very lengthy blog piece on this on our website. You can go read some of the reasons there. But, I see K through 12 teachers off work. I see early Head Start teachers off work. I see Head Start teachers off work. I don't like this double standard where all of a sudden now we're being thrown to the wolves without proper guidance and without proper protective equipment to go do this job without the knowledge and the resources that we need. Now, I'm not stupid. I understand. I was a fireman for many years. I understand essential employees and healthcare workers need childcare. And by the way, I would include childcare as an essential worker. We did a study this morning. Only 17 states are actually calling childcare workers part of the essential workforce. I think that's a mistake. I think that needs to change. We should be getting hazard pay for working in these situations, quite honestly. But I definitely understand the nuances. Again, I'm not some newcomer. I've been working in early childcare for 6 years. I know and understand these issues well. So here's what we're going to do. We'll talk about what to do. And right now, there are 8 states in the country that have mandated the closure of childcare programs. There they are on the map. You can find this again on our website over at childhoodpreparedness.org. We are updating the map constantly. It is, it's hard to keep up with all the different states. And I guess I should pause for a moment. Legally speaking, why are the states taking different approaches? And it seems kind of haphazard. It seems kind of like it's all over the place. That's really just the way that the law is vested in this country. So, there is this thing out there called the 10th Amendment, and that basically it reserves all the powers that are not vested to the federal government to the states. In fact, if you were to ask a law student, which government has more power? Is it the state government or the federal government? Amazingly, the correct answer would be the state governments. because the state governments have what they call plenary power, power to take charge of health and welfare of the states that the people that live in their states. So in each of these cases, much like if you're a doctor or a lawyer or a nurse or a paramedic, you have to get licensed, just like a child care program has to get licensed by each individual state. The state, therefore, has the responsibility and the authority to dictate whether or not programs have to close. So what you're seeing is some states are being very proactive and closing things down, while other states are taking kind of a more laid-back approach. I was reading on one website today, they said, hey, look, you're a private business. We're not going to tell you to close or not. That decision is up to you. And that's how they left it. Whereas the states you see here highlighted on the map, they're taking a stricter approach, saying, no, we're serious. We want social distancing. We realize that half the people that get this don't even know they have it. We don't want to spread it. And we're going to shut everybody down. Now, several states, like Illinois is a good example, have enacted, waivers and emergency conditions to allow essential personnel, frontline personnel, to get child care. But that's kind of what we're seeing throughout the country right now. So if we just look at some of the numbers, and these are about 24 hours or so old, in DC, 400 of the 471 licensed child care programs have closed. In Maryland, about 1,100 of 8,000 programs have closed. Georgia's got a really nice website. Shout out to our good friends Melissa down there in Georgia at DCAL if she's watching. But they've actually got a live tally there on their website showing how many programs are open and closed. So you can start to see across the country, folks are starting to close. This particular, and I just saw one in New Jersey right before this webinar, but there's actually an online petition in Maryland to try to get the governor to close childcare for the sense of safe and health and wellness of our childcare workforce. A similar one, again, just popped up in New Jersey. I will say another thing I saw right before we started was that there is now a confirmed case of a childcare worker getting coronavirus in the state of Ohio. She was a child care worker at the Ohio State University at one of their programs, and she has now been, tested positive for coronavirus. So they have to make some very serious decisions about, what to do to keep that program open. How are we going to notify parents? How are we going to, treat this incident? So this is definitely impacting our sector. Another thing about Ohio, so there were 117,000 kids in subsidized childcare in Ohio. Right now, if you were to look, that number is down to 17,000. So a dramatic drop in the number of kids that are actually attending program. And I know many of you are probably seeing a similar thing. Your enrollment is probably going way down because folks are not showing up. So what we're also seeing is many states are starting to take some action, some regulatory action to either loosen or to tighten down on some of the regulations. In this particular example, the state of Ohio, as of March 26th, which is in a couple of days, Ohio will go down to a maximum of 6 children per room. And this is pretty common. What the states that are taking action, we're seeing them limit anywhere between 6 and 10 children per room or children per class, whatever you want to call it. So it is a very tough choice to stay open. The other thing I just want to give a shout out, there's 6 states right now that are giving incentives or payments for child care providers to stay open. And I can't say awesome, I can't say thank you enough. I think this is the kind of recognition that we need. But, child care is not a business that we get in to become millionaires, as you all know. So the states that are actually taking action to give incentives and give payments, we applaud them. I would like to see more states start doing this. I also would like to acknowledge ACF came out pretty early on with their guidance on early Head Start and on Head Start and on some of the CCDBG money. And I appreciate the flexibility that they gave to let people close their programs and be healthy and be safe and still continue to get paid. I think that's a really nice thing that they've been doing there. So as we're watching, I just got a news alert that looks like the bailout package has failed again in the Senate, unfortunately. But as we're watching that, I know many of the early childhood advocacy groups are front and center, making sure that the early childhood workforce gets some relief and gets some recognition and gets some financial benefit, financial help, I guess is a better word, during this time of crisis, because it is very, very trying. If you're not getting money in, it's hard to stay open. It's hard to pay your staff, and we all definitely get that. Okay, So I don't think, I'm not a fool. I don't think we can just shut down childcare completely altogether throughout the whole United States. There are many healthcare workers and first responders that rely on childcare, and to just suddenly go willy-nilly and stop doing all services, I think would be a big mistake. So let's talk a little bit about, if we are going to try to stay open, what are some ways that we can do this in the safest way possible? And I got to be honest with you guys, it is very difficult because we're learning more about this virus every single day. And stuff that we thought was true last week, we're finding out it is not true this week. So a couple of tips that I have, and again, check with your local regulations, your licensing authority, and all that, because obviously you have to abide by that stuff. But first thing, if you can, try to reduce the number of kids that you have to provide care for. So for those parents that can safely watch kids from their home and keep kids at home, that's a good practice. Let's encourage them to do so. The second thing is limit the amount of individuals that are coming into your space. This includes parents and vendors and visitors and all that kind of stuff. So I know many programs, it's typical to have the parent walk in the front door, walk all the way back to the classroom and drop the child off. And then at the end of the day, come all the way back through your property, go all the way back to the classroom, pick the kid up and walk all the way back out. If you can, I would encourage you to limit that. I know many programs are doing, drop-offs right there at the door so that the parents never have to enter the space. And I think that makes all the sense in the world. The same thing with any of the vendors that you have. If you have, carpet cleaners, if you have food delivery, if you have even just your UPS packages, the more people that we can keep out of our space, the less potential contamination, the less potential exposure we're going to have to this particular virus. Other things, take a look at what the common items are you have around. I was very happy to see a lot of the buffets in Las Vegas close pretty early on. From a public health perspective, we hate a couple of things. One of the things that we hate is swimming pools, because they're pretty nasty when you start to look at the science behind all that. But the other thing that we also hate are these buffets where they have these single-serving, multi-serving utensils where everybody's coming up and everybody's grabbing the same spoon day after day after day. Same thing with our environment as well. If you have pens and you have your parents sign in, for instance, make them use their own pen. Don't be sharing pens. Don't be doing all those things. If you have a system where the parents come in and they log in and they punch in on the keypad, make sure you've got wipes to wipe and clean that keypad between each use. Keyboards, if you're using shared keyboards for your computer to do any kind of entry or anything like that, make sure we're cleaning those off. And if you can, just stick to using your own keyboard, not using other people's keyboards. Limit group size and keep distance. Look, I know some of this stuff is going to be really difficult. Social distancing doesn't work very well in an early childhood setting. But if you can, try to keep the groups a little bit separate. So if you have the availability, if you have the space, try to keep 6 kids over in this corner or in this classroom, and then keep the other 6 kids over in this side of the classroom or this corner of the building. If you read the article that I posted on our website, you'll see one of my recommendations is to use the existing mechanism that FEMA provides after hurricanes and tornadoes and other disasters. And that is pretty good because that'll reimburse cities with the cost of providing childcare during disasters. It'll allow cities to go out and buy equipment to make spaces that were not childcare programs previously into childcare programs. And it'll also allow a mechanism to pay childcare providers who are out of work. So, we've got all these sporting stadiums, we've got all these, K through 12 schools, we've got all these libraries, we got all these big buildings that are now closed because everybody else has been ordered to go out to work. I would really recommend state and local governments looking at some of those venues because they're a much larger footprint than most childcare programs. And if we could provide childcare in these much larger venues, that would help get everybody distanced a little bit more. I know it's not going to be, instantly that you can just turn this on because, doing disaster care and caring for kids in a gymnasium is not easy. But again, the FEMA guidance says that they're allowed to go out and buy supplies and get reimbursed by the federal government to equip these places to care for children. And they could do it now during the pandemic, and then they could keep all these supplies. And if there's ever an earthquake, a tornado, a fire, a flood, a hurricane, they would have these supplies on hand to have these places be, again, emergency childcare programs. So I think that's something that we should be looking at from a state and local perspective. It definitely makes sense to me because I know many programs, you say, okay, well, let's spread people out. Well, the programs aren't that big, right? So how are we gonna do all this stuff? Limit the number of toys that are in use. Again, these are hard recommendations, but if you can, try to limit, one toy per child. And of course, try to discontinue any games that require close contact or touching. When you're, reading a book or when you're doing some activities, have the kids space out as much as you can. And you're creative, you can make a game out of some of this stuff. When they're taking naps, instead of having them all laying so their faces are facing each other, try to spread them out and try to stagger them. So it's, head to toe, head to toe, head to toe that way. For the smaller kids, if they're infants and they're in cribs and you have the availability, space those cribs out, put them farther away in the room. Those kind of things will help as well. Discontinue any kind of hard to clean surfaces. And I got to thank my friend Therese out in Colorado. She's a great public health leader and an expert in this stuff. And this has been one of the things she's been harping on too. Soft fabrics, so clothing, dress-up clothes, sensory tables, water play tables, those kind of things that are hard to clean and hard to disinfect. Let's just not use them for now. We can come back to those later. But let's stick with those toys that are easier to clean and easier to disinfect, okay? Some of the states I've noticed are requiring a daily health check. I think that's a great idea. Again, with the new information that we have coming out, we may not necessarily see somebody with a high fever. So, it's a good thing to do, but we're probably not going to catch everybody. Certainly if a child does have a fever, I think that's a good thing to note. There should be some actions taken to try to separate them from the rest of the children and the staff and get them sent home. Hand washing, often. Make it a fun game for kids, but as soon as they get to your program in the morning, wash their hands. As soon as they, do anything, wash their hands. Remember, we want 20 seconds. We can sing happy birthday twice. You can get creative with what songs to sing. But hand washing is of vital importance in this time. Also, when we talk about feeding, if you're able to feed kids, not necessarily as a huge group, but break it down into smaller groups, that's going to be helpful as well. So very, very important. So here's just some real basic, guidelines that we should be implementing anyway. So sneezing into the crook of your arm, covering your cough with a tissue, throwing the tissue away, washing your hands with soap and water for at least 20 seconds, avoid touching your eyes, your mouth with unwashed hands, clean objects frequently, especially those that are high touch like doorknobs and light switches and telephones. Stay at home if you're sick, limit contact with sick people, and make sure you use soap and water, or if you don't have access to that, use hand sanitizer that contains at least 60% alcohol. It is preferred if you use soap, and you don't need to necessarily use antibacterial soap. Any kind of soap will do. If you don't have access to that, use hand sanitizer if you can find any out there. Most of it's on back order now, right? Another thing which I failed to mention earlier is that there is some evidence that in children, this virus is going to live about 22 days in their throat and in their respiratory tract. So even if they don't have symptoms in young children, if this looks like SARS or MERS, which are two other RNA viruses that are kind of similar to this one, there's been evidence in SARS and MERS, and even some evidence now in coronavirus, that it will live up to 22 days. So again, try to limit the amount of bodily fluids you have on you. There's also some new studies coming out about fecal matter, about poop, and I know we deal with that on a daily basis. And there's some studies saying that the virus can actually live in poop for about 30 days. So changing diapers, very, very important. Make sure you're washing your hands. I know some states require you to use gloves when you're changing diapers. If you can get gloves, not necessarily a bad thing. I would encourage you to put those on and protect yourself. So again, this is the latest information we have. It's changing every single day, and we're trying to give you the latest and greatest. We've been updating all of our resources, and anybody that signs up for our online course over at Childhood Preparedness, we've been providing them with free updates throughout the duration of the pandemic. One last note, dealing in emergencies and disasters, I know firsthand that this stuff can be a little bit scary to folks. I think we need to just take stock and make sure we're not, unnecessarily frightening folks or causing a panic. We will get through this. This is a temporary situation, but it is going to change our reality for a little bit. So, there's a lot of great resources. This one on the screen happens to be from the CDC, and they've got a great children's environmental health team that is working hard to get out resources. I know our great partners over at Sesame Street and Communities have a lot of great resources. And even the Fred Rogers Center up in Pennsylvania that lives on the legacy of Mr. Rogers has put out some guidance on how to talk to children about coronavirus. It's, a lot of it's the same stuff we see in any disaster. Limit their exposure to television, make sure that you're keeping in touch with them, take a sense of any kind of behavior changes if they're starting to get real quiet, if they're, those kind of things are important as well. And of course, be calm and reassuring with kids. You may also want to kind of probe them a little bit and, hey, what do you know about this virus? Or have you heard about the virus that's going around? And again, you guys are very creative. You work with kids every day. You can turn this into kind of a fun game about, hey, let's go kill the virus and wash our hands and sing a little song and make a game out of it. So, again, this is a trying time. I know it's very difficult for a lot of folks, but we will definitely get through it. Also, if you're sitting there and you're bored, you want some free continuing education, we've got our online active shooter courses for free right now. So pop on over, you can grab that. I know we were going to talk about active shooter today, but we'll do that on another time. If you're bored, you could also go online and buy a copy of the new book. I think you'd enjoy it. But at the end of the day, I do want to continue to say that, I have been advocating for you. I think that you are the essential workforce. I would like to see more states recognize early childhood for the role that it's playing, not only today, but every day. And I really think that we need to start being treated on the same level as other first responders and other essential employees. So really, from the bottom of my heart and everybody at the Institute, we work every single day to try to make sure that you're healthy and safe. And that's our continuing mission. We're going to do that for as long as we're around. So thank you very much from the bottom of my heart for all that you're doing for your communities in this time of crisis. I would like you to make sure that you're taking care of yourself and taking the time off that you need and making sure that you're safe. If you have questions, we're certainly going to try our best to answer any questions that you may have, recognizing that this is new and there's not a lot of answers on some of this stuff. But we'll get through this together, and I really hope that some of this information we've talked about today has been useful. So with that, let me see if Ashley's still around and we can try to answer some of these questions.
Hello, I am still around. Thank you so much, Andrew. This was really, really helpful. I think you covered a ton of information, and I know I appreciate it, and I can definitely assume that our entire audience does too. So thank you. We have gotten a lot of questions from our audience. So sadly, we'll only have time for a few, but for those of you that entered your questions, we will make sure that I will speak with Andrew afterward, and we'll make sure that we get everything answered, and we will post them in the EdWeb blog. And so we'll share that link to that as well. So some of the questions that came up, so someone shared that if their state doesn't close their preschool facilities, what is the legal, or any of their schools, what is the legal liability if a teacher or if children become infected?
Oh, that's a good one. Well, if the states don't close you down, then you're pretty much operating, just as you would every single day as a normal business. Now, the coronavirus is so new, I haven't seen any lawsuits filed. So I don't know, and it's going to depend kind of on each state. And I'm not trying to not answer your question. I think it's a very valid question. But depending on the state that you're in, the legal process is going to be a little bit different. So do I think that there's extra added liability if you continue to operate knowing that this coronavirus is spreading around? That's an open question. I don't know. That is a really good question. I don't know the answer to that. We can definitely look into that and talk to some legal experts. I am an attorney, but I don't know the rules of all 50 states, and I don't want to pretend like I'm giving you legal advice here. But it's an excellent question. I do think that there is probably a little bit of risk, and I certainly think in this country you could sue anybody for anything. I could see somebody making the case that, hey, you knew this was out there, you knew this was a potentially deadly virus, and you continue to stay open and not take steps to protect my children. And I could see a lawsuit definitely being filed that way. Now, I think in your favor, you could point to the guidelines and you could say, hey, I was just following the recommendations of my state, my licensure, my public health department, the CDC, whatever. But even the thing about these lawsuits is even if you're 100% right, these things can still go on for 3, 4, 5 years, and you'd have to check with your insurance company. You may not even be covered over something like this because some of these policies don't consider infectious disease transmission and in these kind of situations. In many ways, we're on uncharted waters here. So it's a good question, but I definitely do think that there are some legal considerations here which we probably need to dig a little bit further into. And I do appreciate the question for sure.
Right. Well, nothing like starting off our Q&A with a doozy, right? I think that, that's tough either way. If you close because you're concerned for legal liabilities, then, the ramifications of that versus staying open. So it seems like it's, that's a tough decision. So someone else asked, and this is kind of having to do with definitely having to do with early childhood, but I also think it really has to do across the board for us. So as this is, a community spread and specific populations are catching the virus, is it possible for jobs or, potential employers to test for COVID-19 before you return to work or as part of your job submission, as part of your request for employment?
Well, I certainly think so. I mean, we're seeing that right now every day. The president's doing briefings at the White House, and in order to get into the briefing room, they're actually, testing the reporters that are allowed admittance. Now, they're not doing the invasive test where they put the swab up their nose because right now those tests are so limited. We want to make sure that we're saving those for folks that really need them. And right now the priority is getting people in the hospital who are experiencing some severe symptoms tested. But yeah, certainly, I think that, just like you do a health and wellness check, and if you show up to work and you look horrible and disheveled and you've got a fever and you're throwing up and all this kind of stuff, you can get sent home. I think that might be a future consideration. It's really going to depend on what happens here next week. If we're going to try to reopen everything, as some have suggested, or if we're going to, again, kind of stay on lockdown and let this ride out. But I do think that could possibly be seen out there for certain. The only limitation, I guess, on that is that right now we don't currently have the tests or the lab capacity to do that kind of testing. But, in the future, they're talking about, doing some kits that'll be rapidly available within 45 minutes. You'll still have to get tested by a healthcare professional. But yeah, certainly in the future, especially if you work in a high-risk population. I know many jails right now are looking at ways to make sure this stays away from their inmate population. And that might be something that they're even considering too.
And so President Trump mentioned yesterday in his remarks yesterday as in March 23rd, he mentioned the more rapidly available test kits, the ones where they just swab the inside of your nasal area, but not all the way deep inside your nasal cavity. Do you know anything additional about that? What's the efficacy of that, and where and when will those be available?
Yeah, so I mean, I have no inside knowledge on it, just what I've kind of seen, on news releases and on the TV. I heard earlier this morning that those would be available this week, probably Thursday or Friday. However, this is not something that you're going to do, at home. It is going to probably be able to be done and be self-administered, so I could do it on myself. But then I would, put it in much like you do with a urine sample. Right? You'd put it in a container, you'd hand it over to a healthcare professional. So the big reason why we're looking at those and why a lot of people are eager to get those to market is because it'll save on the personal protective equipment. Because right now, just because the test is so invasive, the healthcare workers have to get basically fully gowned and shielded up and masks and everything to do that stick. It's not a needle, but to do that stick up into your nostril. So if we can, give it to you and you can do it on yourself, that's going to eliminate some of the need for all the excess personal protective equipment. So that's kind of the big push, but it'll still have to be done by a healthcare professional. It'll still have to be sent to a lab. You'll still have to wait to get the results. It's not like an at-home pregnancy test or something like that.
Right. So a couple more questions that we have time for. Someone shared that she's a preschool teacher. They're closed, but she's also an STNA working at a nursing home, and she's curious if she should stay home.
Well, that's really challenging, and to be honest, that's one of the things that scares me is when we have folks that have multiple jobs, and I know many of us do, because you could really see how you could pick up something inadvertently from a child, and then transmit that over to your elderly population at your second job. Now, I recognize you said the preschool is closed right now. I don't think there's any specific reason that you should have to stay home from your nursing job. I do think that they're probably going to be a lot more stringent on making sure that you're safe and you're healthy. I would guess that they're probably implementing a lot of protocols on protective equipment and masks and all that kind of stuff. And because the elderly at such a risk, you're definitely one of the people that we don't want to see going out to bars and going out to large groups of social gatherings and those kind of things, because you could easily transmit that to your patients. And we've seen a couple of good examples. One up in one up in Kirkland, Washington, where this did get into a nursing home, and as you can imagine, once it's in, it's pretty hard to contain. So definitely be taking care of yourself. Make sure you are washing your hands frequently. Make sure you're following the advice. And when you get home for your shift, you're one of those people that I would expect to be basically stripping down, putting everything in the washer, not mixing your clothes with others in your household, and then, making sure you hop in the shower and scrub down with good soap and water so you get decontaminated.
All right. Well, I think we really only have time for one more question, and thank you so much. We've been continuing to receive questions, so we will make sure that that your questions are answered. Thank you so much. The last question is someone writing in saying they are currently closed, and what are the guidelines to how to clean before they reopen, or where could they find more resources?
Yeah, that's a great question. I think we're going to see more states putting out guidance on that. At least I hope that we are. I would definitely encourage, what we would consider to be a deep clean. The problem right now is, as I mentioned, we don't know how long this virus lives. So if we were confident and said, hey, this thing only lives for 48 hours, then you know what? If you close for 2 days, you come back on the third or fourth day, you should be all good to go. But we just don't know. And with that new study coming out of the cruise ship saying it could last for 14 days, that's 2 weeks. That's pretty troubling. So I would definitely say, do a deep clean like you would at the start of your school year. Go in and make sure you're mopping the floors. Make sure that you're wiping down those surfaces that are touched often. Make sure you're cleaning all the toys and all that kind of stuff. Again, on those, pens and pencils and things that we share a lot and get passed around, you may want to, just pitch those and just get some new ones that aren't contaminated. Those kind of things, I think, is what the guidance is probably going to look like. And I do know for a fact that some of the states now are starting to talk about the reopening guidance. So, again, I'm pretty confident you'll see much more of this to come as the, especially around next week. So, yeah, but good question, very good question. And if you got my contact information there, again, I'm on Twitter. We got a great Facebook page. We're always answering stuff and putting out great resources. The website, certainly we update, every day, several times a day. So if you ever need anything, please let us know. We'll do the best that we possibly can do to answer these questions. And again, I'll follow up with Ashley and make sure that we get kind of a frequently asked questions document posted online to try to address some of the stuff. And again, a lot of stuff we just don't have good answers for, and we'll be honest with you when those questions come up that we just can't answer at the current time.
Right. Well, thank you, Andrew, so much again for your time. Thank you all for joining us. We really appreciate you sharing your advice and guidance during this incredibly challenging and scary and uncertain time. So thank you. Just a reminder, thank you all for joining us. We are offering as a sponsor of this webinar, we're offering you 20% off our Griffin House books, including Andrew's latest release that was released just this month, Preschool Preparedness for an Active Shooter. So please do take a look at that. Thank you for attending. You can learn more visiting griffinhouse.com. And of course, edweb.net/bookchats. Join our online community. It's completely free. You'll access this recording. You'll be able to take the quiz to get your CE credits. You can download the slides and the chat log and much, much more if you visit edweb.net/bookchats. Stay tuned. Our next webinar will be about the play-based approach to an emergent curriculum and school readiness. So we're hosting that Thursday, April 16th at 2 p.m. Eastern. So go ahead and join us for that one. So thank you again to you all for joining us. Thank you, Andrew, for your time and your expertise and all of your recommendations. It's much, much appreciated. And everyone, please stay safe and stay healthy and continue to take care of yourselves. So thank you all.